In this presentation, I've showed 6 studies that have found that there is a correlation between anxiety and avoidant behaviors. It can be seen in each of these studies, and each study kind of goes about it in a different way. One of them looks at oxytocin levels, one of them looks at attachment. There's a variety of ways that researchers have looked at these two different variables and their relationship to each other with other variables impacting them. But the one main staple that we see is that there is a relationship between avoidance and anxiety. When I started out, my hypothesis was that there was an effect between anxiety and avoidance, but more specifically that avoidant behaviors would affect anxiety. And we do see that. We see it in the reverse more often, but there are cases where avoidant behaviors can increase anxiety levels. For example, if somebody puts off work, they avoid doing all of this work because the stress of reaching that goal is just too much. Then they will continue to have that stress because they aren't doing what needs to be done in order to take care of that anxiety. So those are just examples of that hypothesis. So we did see that hypothesis play out, and even in the model that was shown, we see that whether a person is a healthy person who has not been clinically diagnosed, or if a person has been clinically diagnosed with anxiety disorder, that avoidant behaviors are there. It's one of those learned things that happen early on, and that learned behavior can affect us in every area of our life. Especially when it comes to anxiety. We see that if there's a high stress situation, then somebody with a clinical diagnosis is going to exit that situation or avoid that situation quicker than somebody who is healthy, but overall that healthy person too will exit the situation if the stress becomes too much. So all in all, we see that hypothesis is proven. It's not proven, it's supported. And so we see that avoidant behavior can, in fact, affect anxiety levels.